Hello, I am Dr. Jennifer Ripley, and I'm going to be talking a little bit about what we've been doing over in the Charis Institute here in the School of Psychology and Counseling within the College of Healthcare and Behavioral Sciences. And I am a professor of psychology and the Hughes co-chair of integration for Regent University, along with my colleague, Dr. Jim Sells. And we co-lead the Charis Institute here. And we're just going to give you a little lab report of a research study we've done recently and then what's happening in the future for us for a minute. So, um, what we have just been completing, the data has just arrived into the inbox and is currently being fully analyzed, is called the Family Cars Project. This is competency addressing religion and spirituality, particularly focused on family relationships. As we all know, family relationships can sometimes have a little bit of tension around them when it comes to religion and spirituality factors. So we wanted to create a research study that would study the training of clinicians, of therapists. And we were training therapists in this study of all religions. So we were inclusive of any therapist. This is a work that we were doing that would extend beyond our own personal religious beliefs into all clinicians and be able to provide something good for the larger field of psychology. We respect religion and spirituality is important. That's something that's very common for us at Regent University, but it is not common in the larger field of counselors and psychologists. And so we were promoting the idea that religion and spirituality is an important factor, to respect that of the clients, and to use what's called family systems concepts to help us all understand better how to address family needs when religion and spirituality is either a tension or a resource for the family. So we're trying to increase competency. That's our goal. We had three objectives that we worked through for this project. One was to create an online resource with a community of learning environment. You know, teaching at Regent University has been great because we have all learned how to create these online learning environments that can be done really well. And so we applied all of that, and Jim Sells and I created a video series that was available for that. And then we delivered the 5 hour training. So it was a 5 hour training. It wasn't a small amount of training. It was a substantial training that was delivered to graduate students and professionals in counseling, social work, marriage and family therapy, and psychology across a spectrum. And then we did a research study to examine what are the results of this study and how well did it help people. We created a website and we had collaborative groups of people that worked with us. One of them that's really important is the John Templeton Foundation that funded the project for us. And then we had partners at the University of North Carolina, Charlotte, University of South Alabama, and Stetson University who had various roles in the project with us. And we had colleagues at various other state universities in Texas and Georgia and Michigan and Pennsylvania and everything who promoted our work, and that was great. We were part of a larger project that is studying religious and spiritual competencies. So the SRCP is a larger project that's a $5 million grant from the Templeton Foundation, and we were one out of 20 of those studies. And so this is something that's having a larger impact on the field because spiritual and religious competency is being addressed in a broader zone. And we got to be one of them and to have a voice from Regent University for that. Just to give you an idea of what it is, there are just two ideas from the training that we offered. One was the importance of non-anxious presence, which is both a religious idea, a spiritual idea that's taught in the Abrahamic religions, but it's also a family systems concept to be able to address tensions, issues, needs without anxiety, and for the therapist to come to the room as a non-anxious presence. Another is called multi-directional partiality. This is where the therapist gives voice to each person in the family or each person in the couple, to their needs, gives respect to them, to their perspective, and that's a very important part of doing therapy with a family or a couple. And so being able to address that and apply it to religious and spiritual needs or tensions in the family. So we were teaching that and other ideas too. The results of the study, one was that we were a little worried about participation. A 5-hour online training is a big ask of busy graduate students and professionals, but we found that participation was not a problem. We actually had 172 people participate between March and November of 2023. We were really excited. And of those, 74 completed not only the entire training, but also 3 different times of measurement, pre and post to the project. So that was really great. The results that we have found, just looking at them on a basic level so far, is that both attitudes and behaviors are improving after the training. So people are more accepting of religious and spirituality is important. It's something they need to respect for their clients, and also something that they are actually beginning to implement, to ask more questions and to bring it up more often in the therapy that they provide. I also wanted to give a shout out here. We have a current study underway that's just finishing from Dr. Vanessa Kent in the counseling program, conducting qualitative interview research of a subset of the participants. We kind of get a deep dive on those participants about what the training was like for them and how they've actually been trying to implement it. And then finally, it's not over. Of course, we have publications and presentations. We have one publication already out and accepted for this project of the conceptual work that we're doing. And then we have additional research. We have invitations already for 2 additional publications. And then we're waiting on presentations. We had one last year, and then we have some more coming this summer, I think. But we're really excited that we have some funding that's arrived that has come from an donor that is called the Mental Health Ministry Project. And Dr. Jim Sells is the principal investigator on that. I will be the co-investigator. You may know Dave Valoni in the law school. He will be a co-investigator. Or Danny Holland, if you know him in the counseling program. They're also co-investigators with us. And we are partnering with an online organization called 7 Cups, which is a former Regent faculty that runs that actually, and the Southern Baptists, and a bunch of other churches that we're working with, and we're not quite ready to say who they are yet, and Young Life Organization, to provide mental health care resources to the church and parachurch organizations. So just want to thank you for listening to what's going on in the Charis Institute. Don't hesitate to ask if you want to check out the familycars.org website. You can look at that, and my email is right there. Thank you so much.